Thank you so much, and hello, everyone. Thank you for joining this webinar and spending the next hour-ish with me. I am thrilled that you're here. And yes, we are going to be talking about managing pain and inflammation as it relates to pancreatitis. And so first of all, I want to thank Zomedica for having these webinar Wednesdays and for offering this CE to all of us, right? To my veterinary colleagues and my veterinary technician colleagues around the country and really around the world. So a huge shout out to Zomedica, and thank you for having me. I am honored to be here. And so first, we're going to talk about, okay, pancreas. We all know what the pancreas is, right? And does. It produces insulin. It helps to regulate blood sugar levels. And in dogs without pancreatitis, the body's mechanism to prevent active pancreatic enzymes from coming in contact with surrounding tissues. So when these mechanisms break down, those active enzymes are released into the surrounding tissues, leading to autodigestion. And so, we know that if we put itis on the end of a word, right, of an organ, then it's inflammation of that organ. And so pancreatitis is, yes, inflamed pancreas, right? Okay, we all know that one pretty well. So what we don't always admit to, I would say, is that pancreatitis is a fairly common disease in dogs. And I don't mean around certain holidays or, during the summer when there's, multiple cookouts or barbecues, depending on what part of the country you're from and what you call them, right? But pancreatitis really can be underdiagnosed because dogs can suffer from mild recurrent bouts. And, the owner would just say that, oh, they had a bad day. They weren't eating well. They were lethargic. Maybe they vomited a bit and they were getting ready to make that call. But then, as the hours of the day went on, they started to appear to be improving. And so, you know, um, it's so our pet owners don't really know that could be, a subtle, if you will, if there is such a thing as subtle pancreatitis. But this could be happening much more often than I think we give it credit for. And it's extremely painful. I probably don't have to tell anyone out there in webinar land that this is a very painful disease condition. And, acute pancreatitis is the most common form of disease seen by our veterinary hospitals. It can be a life-threatening disease, and oftentimes it requires prolonged hospital stays with pretty intensive monitoring. And so the thing to realize is that a dog that has one bout of pancreatitis often will return with another bout at a later date if changes in its lifestyle are not made. And so, as I mentioned, acute pancreatitis, what does that mean? Well, we all know, sudden, right? And we oftentimes see these dogs coming in after they've had, fatty food. So you can see it on here, right? This pug is trying to get that bacon, right? Pugs love everything. So yeah, they're most certainly going to try to get that bacon. But, pork, beef, fatty human foods. And if we look at it, I'm going to come at it from a nutritional standpoint. And so if we look at pancreatitis, and yes, we know certain fatty foods, but look at the habits of our pet owners and, people in general. They consider their dogs as members of the family, which is wonderful, but they're also feeding them like they would feed themselves. So they're going through Starbucks, right? And getting a Starbucks for them and a puppuccino for their pet. They're going through McDonald's and getting, some value meal for themselves and a happy meal for their pets. So not only are we seeing, an incredible amount of obese dogs and cats, in our patients, but we are also seeing these fatty foods that are being given much more often than they were, say, even 15 years ago. And then there's also the garbage gut dogs, right? What do I mean by that? You guys know as well as I do, those dogs that like to get into the trash in case, they don't want to miss anything that may have been thrown into the trash. I have one. I have one that and it's not either of my Frenchies. We also have a 45-pound Aussie Border Collie cross who does not want to miss even a morsel. And so if she could get into the garbage, then she most certainly would. So we know these dogs, we know the time of year again, right? Thanksgiving is a big one. We know around Thanksgiving time or around the holidays, they're coming in because they have gotten into or have been given foods, especially fatty foods that they are not accustomed to. And so then what is chronic pancreatitis? Well, it's no surprise, right? It occurs slowly over time, and it can develop from several acute cases of pancreatitis. And that's why it's important for us to remember that not all bouts come into the hospital. As we mentioned before, there may be some short-term bouts where the owner, notices something, but not to the extent of a true acute bout that you and I are envision when we talk about pancreatitis. So let's look at some risk factors, okay? What about risk factors for cats? Because yes, cats do get pancreatitis, not quite as often as dogs. But if we're looking at it, it's really cats of any age, breed, or gender can develop pancreatitis. If we're looking for some, prevalence data, then older cats appear to be more likely to develop chronic disease. And although there's no breed specificity, it's easy for me to say, we are seeing it more in domestic short-haired and Siamese cats. That's not to say every Siamese cat is going to get it, but it's something to keep in the back of our minds if a Siamese cat comes in. So what about the risk factors for pancreatitis for dogs? You guys know this as well as I do also, right? So if I were to ask you, there's one of them on, on the screen now, right? Certain breeds are more commonly reported. So miniature schnauzers, those are like the poster children, right? For pancreatitis in dogs. Miniature poodles, cocker spaniels. And then, how about aging? Aging makes some dogs more susceptible. And then what about obesity? Obesity is a risk factor for way too many things, which is why we have to, that's a separate topic, but we're going to have to address obesity in our cats and dogs. But yes, obesity is also a risk factor for pancreatitis. And then, as we mentioned, if we look at food, I mean, look at this. What is that? Fish and chips or chicken strips and fries, whatever, it is. So many times that habits and practices studies show that owners like to cook for themselves and for their pets. So whatever they're cooking for themselves, they're going to give their pet as well. We already mentioned that owners are going out and purchasing fast food and making sure their dogs have some as well. And then there's the garbage gut dog. I don't think Basset Hounds are the poster child for that. My understanding is now it is Labrador Retrievers. When I first started way back in the day, it was German Shepherds. But we do know now that Labrador Retrievers will pretty much eat anything. So they have taken over that mantle of being the lead garbage gut breed. So, all right. So how about concurrent diseases, right? As a risk factor. I won't belabor it anymore, but we have talked about obesity, right? The most common concurrent disease that puts dogs at risk for pancreatitis. It's also one of the most preventable risk factors. Certain medications, such as anticholinergics, azithromycin, chlorothiazide, furosemide, and tetracyclines, are associated with increased risk for pancreatitis. Hypercalcemia. So, most often associated with lymphoma, but also other cancers. The picture here is a dog with lymphoma. And then hyperlipidemia, right? We're going to talk more about that, but hyperlipidemia can be secondary to pancreatitis, but it can also be a risk factor for pancreatitis. So if I were to ask you, right, tell me some of the signs and symptoms. You guys are probably just like ticking them off in your head, right? Probably while you're eating your sandwich, or if you're happen to be on a break, right? So yeah, vomiting, diarrhea, severe lethargy, dehydration, right? And then, what are we seeing here? We're seeing that painful position, right? This dog is in pain. His abdomen is very painful. So he is trying to find that one position. So that downward dog position that is not as painful as other positions. But we see this often, right? So abdominal pain, fever, shock, collapse, jaundice. And so you heard that I'm a veterinary technician. I'm going to help you with your diagnostics, but you are going to make the diagnosis for those veterinarians that are out there. For the technicians, we also need to know this because we are oftentimes running the diagnostics to then, bring to our veterinarians. So history, nutritional history, obviously, we'll get more into a nutritional history. Physical exam. So we want to know the body condition. Is that abdomen painful? And then diagnostic imaging. You see here on an ultrasound, right? And, it's pretty amazing that in today's day and age, so many of our general practices have ultrasounds. So, let's use those. It's a great diagnostic tool when we're dealing with pancreatitis. So I mentioned history and nutritional history. Hopefully we are all pretty much on board with how to take a history. But what about a nutritional history? And is that important? Of course it's important, right? Because food is such a big part of causation for pancreatitis. So really, to begin the consultation, I like to ask, what are you currently feeding and why? Because oftentimes we are going to find out, that they're feeding maybe something we weren't really prepared for and we weren't actually going to make a recommendation for, but we want to know their why before we can start making our, coming up with a nutritional assessment and making our recommendations. If they have a specific diet in mind that they have been feeding, we need to know their why behind that. And, we also need to know, is the dog considered a member of the family? Most likely, yes. So are they participating in birthday parties, right? Does the dog get donuts when the owner gets donuts? And, to what extent is that family member sharing their food? I mentioned earlier that habits and practices studies show that owners that make, that cook for themselves at home often cook part of that meal also for their pets, especially their dogs. So, and that's in addition to, any kibble or canned food that they may be getting. So we want to utilize a nutritional history. This one, there's free ones out there. Get your teams to perform a nutritional history. Doesn't take any more time. and it's going to help us manage these cases. So, and we should be doing it on every pet every time they come in anyway. But it's going to be open-ended questions, trying to find out, okay, what's the normal everyday food that these pets are eating, and then what as a family is being given to the pet. So, and these, after a while, you get used to the questions, right? This is just going to start those prompts, right? So tell me about your pet's living environment. Yeah, that is important as part of a nutritional history. Do you have other pets? Yeah. What if they have cats? Is the dog getting into the cat food, right? Tell me the arrangement for feeding your pets, right? And you can read them. And if you don't have one, I'm more than happy to send this to you. So then, we also want to look at, we have the ultrasound, perhaps you're using radiographs, right? Because we're trying to rule out foreign bodies, any displacement of organs. And then the ultrasound is going to confirm pancreatic inflammation. And so here, the ultrasonographic appearance of the pancreas of a dog, this is a dog with pancreatitis. So the pancreas is enlarged and appears heterogeneous with hypoechoic areas, which are the white arrows. I'm a nutrition technician, not a diagnostic imaging tech, so I like it when they have the arrows. The black arrows are hyperechoic surrounding fat. So we see that in here. And so what would you tell me this is suggestive of? Pancreatitis? And you would be correct. So what we're going to talk about today in terms of management is nutrition, fluid and electrolyte therapy, also part of nutrition, anti-nausea and anti-vomiting medications, and pain management. So we're going to talk about all of these, but we're really going to focus on nutrition and pain management. So if I were to ask you, metabolically, are these two dogs the same? What would you tell me? So this is a dog with pancreatitis. This is a dog with chronic food deprivation. So for about 6 months, this dog has received food, but obviously not enough food. So it's being deprived. So what would you say? You'd say no, right? The dog on the left, sorry, I had to look at it for a minute, is suffering from stress starvation versus the dog on the right, which is simple starvation. Okay, so they both look, emaciated, and they appear clinically identical, but metabolically they are very different. So what am I talking about? Well, what is the difference, right, between simple and stress starvation? Well, in simple starvation, lack of food intake causes a normal metabolic shift to a hypometabolic state because the body's trying to conserve structural and functional proteins as much as possible. So glucose and fatty acids are, right, the primary energy sources. Whereas in disease states, the inflammatory response triggers alterations in cytokines and hormone concentrations and shifts that metabolism toward a catabolic state at the onset of that disease. With a lack of food intake, the predominant energy source then is derived from accelerated breakdown of endogenous proteins. We know that to be proteolysis. So these animals are actually preserving fat deposits in the face of lean muscle loss. So we need to get nutrition into these guys early and often. Okay, so you see that here. Stress starvation is that inflammatory response where the body is actually eating its own lean muscle, utilizing its own lean muscle, and it's in a catabolic or cachectic state. So we see this inadequate nutrient intake and stress starvation in, a number of urgent issues, emergent issues, but pancreatitis, right? So the consequences of inadequate nutrition in diseased and debilitated patient further complicates the management of the underlying condition. So disease and debilitated patients require nutrients daily to maintain optimal immune function, tissue synthesis, tissue repair, and for the veterinarians out there who are prescribing medications, if we're not getting nutrition into these, then that medication or those drugs that are being metabolized, that metabolism is altered. So what I want us to take away is that GI conditions respond to dietary intervention. And early nutritional intervention is crucial in these patients. And we're going to talk about key nutrients that's going to help manage our pancreatitis patients. So historically, the nutritional recommendation for management of acute pancreatitis has been strict pancreatic rest, right? And that is from the belief that fasting prevents feedback that will further stimulate exocrine pancreatic secretion, thus protecting against autodigestion to some extent. This theory, though, is from human medicine, healthy humans at that, and has not been tested in dogs or in cats. And it's come into question and is actually, if you read any of the studies from our criticalists and from our nutritionists, this is no longer the recommendation. It's been demonstrated that with naturally occurring disease, that exocrine pancreatic secretion is in fact decreased during pancreatitis. And the decrease is most prominent in patients with severe inflammation. And so in fact, rather than being beneficial, fasting these patients leads to intestinal mucosal atrophy, enterocyte apoptosis, and a breakdown in the intestinal barrier, resulting in increased intestinal permeability. The consequences of these alterations in gut function is that gut itself starts to contribute to the systemic inflammatory response in acute pancreatitis. So, are we going to hold them NPO? No. So enteral nutrition is the most potent stimulator of intestinal mucosal regeneration. And in addition, enteral nutrition may decrease cytokine production, modulate the acute phase response, decrease catabolism, and preserve protein. And so when these patients are coming in, instead of holding them off of food, then we want to start enteral nutrition as soon as possible. And that can be done with, the new antiemetics. So new, they're not so new today, right? We've had Serenia for a while. And so they come in, they're feeling lousy, antiemetic on admission, pain medication. We'll talk about that a little bit. And then tube or oral feeding. But I think if we can get a tube in these guys, tube feeding is not a major thing. And depending on your state, some technicians can put NE or NG tubes in. If not, then veterinarians just put that tube in and then hand it over to your technician. So what are some of the advantages of enteral feeding? I mentioned these, right? Decreased bacterial translocation, increased immune response, and decrease in cytokine-generated stress response. And so here's just one, short study, but it's showing that in acute pancreatitis, 10 dogs were put on either parenteral nutrition or enteral nutrition. And, survival, all 5 of the enteral nutrition managed pancreatitis cases survived. 4 out of the 5 parenteral nutrition ones survived. Now, in a big study, 4 out of 5 or a high percentage such as that is, that's not bad. But imagine if that, out of only 5 dogs, imagine if that one dog that didn't make it was your dog, right? And then also with the enteral nutrition, there was no increased pain with feeding. Vomiting, there was a difference in vomiting. Only 1 out of the 5 enteral nutrition dogs vomited versus 3 out of 5. And then catheter complications were seen with the parenteral nutrition. So yeah, it's a short study, but and we have seen more. We need more, but this is one study, pointing in that direction of let's get food into these guys as soon as possible. All right, I don't know why that came up again, but let's go to this one. So early enteral nutrition helps to stimulate regeneration of that intestinal mucosa, helps to decrease cytokine production, helps to modulate acute phase proteins, and decrease catabolism. The last thing we want is for these guys to become cachectic and start using their own protein sources. So early enteral nutrition helps to preserve that protein. And as I mentioned, and for the veterinarians out there, this is your bailiwick, not mine. Although I will, give this on your direction, right? But the newer antiemetics make this possible, right? Cerenia. I have seen so much good done with Cerenia. So if we can get Cerenia on board and then start feeding as soon as possible, instead of waiting and resting that gut, we're going to see earlier discharges. The patient will feel better sooner. The quality of life while they're in the hospital, that patient is going to be feeling so much better. So here's, it's clear that there are significant metabolic derangements associated with, this stress starvation. Does it affect outcomes in these patients? Yeah. So, the metabolic alterations that occur during stress starvation affect clinical outcomes. Getting nutrition into these guys affects clinical outcomes. And so this is looking at energy balance. It was looking at energy balance. There we go. Okay, bizarre. So it's looking at energy balance to clinical outcome, right? In hospitalized canine patients, 73% of these 276 dogs were in a negative energy balance. 22% were due to illegible orders. So veterinary technicians out there, if you can't read your doctor's orders, what are you going to do? You're not just going to blow them off, which apparently happened in this study. You're going to go and ask your doctor, what does this say exactly? What do you want me to do? Right? Your doctors want you to do that. You have to do that. 34% were held NPO. And this is what we've been talking about. We don't want to hold them NPO. We want to get nutrition into them. 44% refused food. Now, I think in this instance, it was just someone put a bowl of, kibble in there. The dog feels lousy, right? They may not have had pain meds or even antiemetics yet. So of course the dog is going to refuse food. It's a stressful situation. The dog feels lousy. Now, conversely, 27% had a positive energy balance. And with that, right, were better outcomes, shorter hospitalizations. These patients had, with a positive energy balance, had much better clinical outcomes. So again, let's get nutrition into these guys as soon as possible. Going to have better outcomes, shorter hospitalizations, better quality of life by getting nutrition into our pancreatitis patients. And so again, I'm going to encourage everyone to, consider an NE or an NG tube for these patients, right? Yes, we can also esophagostomy, gastrostomy, but, getting a short-term tube in to get nutrition into these guys is not very difficult. It's not difficult, period. So, use of the indwelling feeding tube is the method of choice if enteral assisted feeding is necessary. And so you can see those here, but I won't dwell on that because feeding tubes, all about them, is another talk. Now, enteral nutrition, right? It is well tolerated, especially if it's easily digested and easily absorbed, because these patients need essential nutrients. And if it's a high energy formulation, that will be even better because we can feed smaller amounts, or we can feed a larger, sorry, I'm all messed up. We can feed a larger amount or a high energy food more often throughout the day. Whew, should not have been that hard to get that out, so I apologize. So we can feed a high energy food more often throughout the day. So hopefully I didn't mess that up too much and you guys knew what I was trying to say. So how about elemental or semi-elemental? Well, in veterinary medicine, there truly isn't elemental nutrition. There are some for humans, but I like to utilize those that have at least been fed to and formulated for cats and dogs. And with that, we have semi-elemental foods. And we know this pancreatitis patient has no energy to spare, right? That energy is better served in the healing and repair of the body. So if we look at elemental or semi-elemental nutrition, what am I talking about? Well, it's highly digestible nutrients in small sizes for quick and easy assimilation of those nutrients. We talked about, ensuring that we get nutrition into these guys, really for their gut health. And that is what we are trying to do. We are trying to ensure that these enterocytes, which line the GI tract, right, stay healthy. And because then we will have the maximum absorbable nutrition in the GI tract. So, you can see here that that in the gut we have villi, we have enterocytes. The food is broken down by these enzymes. All of the vitamins, minerals, and nutrients get absorbed into the bloodstream. But if we have a pancreatitis patient or a severely ill patient, then that blood is going to the more important organs. So if we don't want this patient, if we don't want their GI tract to do extra work by providing semi-elemental nutrition or nutrients that are already broken down, then the GI tract doesn't have to provide or go through that extra work. The body's goal is to support key organs, right? In severe disease conditions, heart, brain, liver, lungs. So the blood flow to the GI tract is reduced, which is going to slow, and some cases significantly slow, GI motility or movement. So as I mentioned, I talked about enterocytes. They form a tight seal to protect the body from harmful bacteria or toxins. And then digestion and absorption of nutrients are also altered. So unfortunately, all of these changes mean that when the body needs nutrition the most, right? Because that's what I've been talking about, then it's more difficult for nutrients to be absorbed. So this is why debilitated patients benefit from a pre-digested, if you will, or a semi-elemental diet. So let's look at some key nutrients. Water. Remember, water is extremely important. So we have a pancreatitis patient, right? And that pancreatitis patient is coming in dehydrated, right? From acute vomiting, right? And perhaps diarrhea, right? They could be losing it from both ends. And so that potential for life-threatening dehydration from excess fluid loss, is happening, and then the patient is unable to replace that lost fluid. So, sorry, I didn't finish. So we need to, and I'm sure this is one of the things that you guys do automatically, right? Get an IV set up and running, and we are, setting up our fluid rates, making sure that we are working to reverse that dehydration. Now, electrolytes. Gastric and intestinal secretions differ from extracellular fluids in electrolyte composition, so their loss can result in systemic electrolyte abnormalities. And dogs and cats that present with vomiting and diarrhea may have abnormal serum potassium, chloride, and sodium concentrations. That's why at the beginning, we mentioned, management. We need to keep an eye on the electrolytes of our patients. Serum electrolyte concentrations are useful in tailoring appropriate fluid therapy and nutritional management of these patients. And so typically we'll see mild hypokalemia or hypochloremia, and the sodium in these patients, we also need to watch, because we could see either high or low sodium levels. And so again, as technicians, we can be monitoring these, and we should be monitoring these. All right, I think I covered everything you need to know there. Protein, free amino acids, right? In the duodenum are a strong stimulus for pancreatic secretion. In fact, more so than fat. What? Oh, no, that can't be, right? So excess dietary protein should be avoided, but we do have to get adequate protein for recovery and tissue repair. So, so we have to make sure, protein is kind of a balancing act. So as long as we are feeding the percentage for, the life stage of the pet, then we should be okay. But we don't want to, to worsen things by feeding high amounts of protein. Conversely, they need enough to live on and to repair tissue. Glutamine. And this is why I get excited about nutrition for management of disease conditions, because here's an amino acid, right? Glutamine is the most abundant amino acid in the plasma, and it's essential for a wide variety of physiologic processes. The pancreas, right? We know it has high protein turnover. Glutamine supplementations in animals has prevented atrophy of pancreatic acinar cells, improved pancreatic exocrine function, and improved outcomes following critical illness. Arginine is another one, right? Arginine is another amino acid. So again, the building blocks of protein, this specific building block has immunomodulatory functions. And when patients are ill, arginine is reduced. So they're not getting enough arginine, which can result, again, in the death of that patient. So we need to make sure that the protein is a high quality protein, it's highly digestible, easily absorbed, and if it's a high quality protein, then we know that it will have glutamine and arginine. Fat, this is the one that everyone is concerned about, right? Solids and liquids higher in fat empty much more slowly from the stomach than comparable foods with less fat. Think about the last time you had a high fatty meal, right? And if you like, fatty foods, fried foods, then you may be like, oh yeah, that was delicious, right? But then 4 hours later, it's still sitting there and you're not really hungry. So that's because they empty more slowly from the stomach. Fat in the duodenum stimulates the release of cholecystokinin, which delays gastric emptying. And so what we want in our pancreatitis patients is low fat. And by low fat, this is why, see, it all comes full circle. This is why we need to do that nutritional history, because we want a lower fat amount than in the food that they were feeding prior. So we have to find out what they were feeding. And then, from here on out, when they're discharged, they will be on a food with a lower fat amount than their prior food. So typically at this point, it's foods with less than 15% dry matter basis fat for dogs and less than 25% on a dry matter basis for cats. So we know the digestion of dietary fat is more complex than the digestion of proteins or carbs, and it can be easily compromised. So dogs with a wide variety of GI problems, especially if it's pancreatitis, can show maldigestion and or malabsorption of fat. So decreasing the fat content in the diet, yes, that may improve clinical signs in these patients. Now, I said in the last one, 15 or 25%, right? But for our obese and triglyceridemic patients recovering from pancreatitis, they should receive even lower fat foods. So equal to or less than 10% on a dry matter basis for dogs, and equal to or lower than 15% on a dry matter basis for cats. This lowering of the fat content in their food will help to reduce fasting serum triglycerides. Now, there is some ongoing research that is saying that cats can digest and use high levels of dietary fat, which we know is true, but I'm talking about it, with cats with pancreatitis. And some of that evidence right now is saying, it's not really supporting restricting fat in cats with pancreatitis. More to come on that. As I said, the research is ongoing, but just to, let you know what is being looked at by our colleagues in the profession, by ECC critical, or our diplomates in ECC and our diplomates in nutrition. Cobalamin. I cannot tell you how important cobalamin is. Assessment of serum cobalamin is recommended in cats with pancreatitis, especially complicated by IBD or triaditis. There it is again. If levels are depleted, parenteral supplementation is recommended. So cats should be receiving 250 micrograms per cat every week for 4 to 6 weeks. And then once or twice monthly therapy might be required for longer term maintenance. My own cat required this, had that, was prescribed that dose, and then did need once a month continued cobalamin injections for longer term maintenance. Antioxidants, right? So, we're normally free radicals created during energy production are detoxified by the body's natural antioxidant defenses. But we know that these free radicals, so as the patient is aging and as, disease condition is being fought, then we're seeing less energy produced by the mitochondria and more free radicals produced. Free radicals impair cell function. They're decreased and they result in eventual cell death. So we need to make sure that we are including antioxidants in our nutritional profile. And then you knew they were coming, right? Omega-3 fatty acids. So again, with our pancreatitis patient, we're trying to break that inflammation cycle, right? We know that it's a cycle of inflammation. It's an inflammatory disease process. So omega-3 fatty acids are anti-inflammatory and they help to stabilize the cell membranes. So this is just, a summary if we're looking at fat and protein for our dogs and cats. And this is on a dry matter basis. So antiemetics, we already talked about these. Begin immediately, right? The veterinarians out there, you guys know this is in your domain. So, but hopefully I have, shown you that by starting antiemetics, immediately when the pet comes in, then we can start nutrition immediately, and we can see the benefit of that in our pancreatitis patients. And analgesia, so pain meds, right? Dogs with pancreatitis have local and visceral pain. So we should be using a pain scoring system. And, if we look at the vital assessments, temperature, pulse, respiration, the fourth vital assessment is pain management or a pain evaluation, pain assessment. And the fifth is a nutritional assessment. So now we have our 5 vital assessments: temperature, pulse, respiration, pain assessment, nutritional assessment. And there are lots of different pain scoring systems out there. This one is from Colorado State, right? If you, as I said, there's a number of them out there. If you go to the IVAPM, if you just Google pain scoring systems, I know AAFP has some for cats, so they're out there. The important thing is we find one that the whole team can support, and we are scoring that particular pet's pain. So I just wanted to touch on this. Obviously, I am not prescribing drugs used for treatment of pancreatitis in dogs, but I do want us to remember how painful a disease condition this is, and that our veterinarians will be prescribing some pain meds for pancreatitis. So we as veterinary technicians should be familiar with the medications that are being prescribed. So abdominal pain is a key clinical sign in pancreatitis. And so we should be, as we just talked about, prescribing pain meds, not me, but the veterinarians. And intermittent dosing or continuous rate infusions are oftentimes used as well. But what I want to talk about now is the Assisi loop. So let's take a closer look. Assisi Animal Health, part of Zomedica, who is our sponsor, so thank you. But even if they weren't sponsoring, I have this built into my presentation because the Assisi loop is so beneficial in managing pain in our pancreatitis patients. And, it's targeted pulsed electromagnetic field therapy, and it's portable and easy to use. Why is portable important? Because the owner wants to be involved, right? And this is something that they can do at home, which is going to help their pancreatitis pet. So, it delivers a signal that's tuned specifically to minimize pain and accelerate healing. So, for animals experiencing pain or inflammation, the loop employs this targeted pulse electromagnetic field therapy, and it stimulates the body's own natural anti-inflammatory process, while again speeding healing of soft tissues. So the mechanism of action is to upregulate the production of endogenous nitric oxide, which is the body's own anti-inflammatory molecule, to help speed healing of soft and hard tissues. But here we're talking about soft tissues. And I have seen wonderful results using the Assisi loop. So we know that nitric oxide modulates healing both for humans and animals. And actually this therapy was first used in humans. And again, the signal delivers the largest effective dose to the nitric oxide signaling pathway. And, no other signal has been purposely configured in this manner. And so you already heard of some of the benefits, right? But other benefits, it helps to reduce pain. We talked about that. It increases mobility, right? As that pain is reducing, the patient starts to feel better, helps improve circulation and accelerates that healing. Again, it reduces swelling, but we're talking about reducing inflammation, and that's what this is aimed at. It's compatible with other treatments for pain and inflammation. So if you have your patients on a specific medication, and hopefully a nutritional profile, then you can also use the Assisi loop. It can reduce the amount of pain medication that the patient may have to take. There aren't any dangerous side effects. And again, the owner can be a part of their patient's pancreatitis therapy, the management of this disease condition. So we've talked about quite a bit. We know that we know what pancreatitis is, right? Yeah, we did a quick review of that. But we know that pancreatitis is extremely painful. We also now know that early feeding, so getting food into these guys by mouth or using the GI tract, is going to lead to an earlier recovery. And pancreatitis, right? We now have nutrients that can help manage pancreatitis and different modalities for pain relief. So I want to thank all of you for being here with me this afternoon or morning, not quite sure where you're tuning in from. And I also want to thank Zomedica for offering these Wednesday webinars, for having me. I'm honored to be here to talk to all of you, and for providing this this educational session. So thank you all very much. If you ever have any questions about nutrition or anything that we talked about today, or nutrition in general, utilizing your technicians, it doesn't matter, then just drop me an email. My email is on the screen. So thank you all so much.